I wanted to give you some practical examples of open health. I'm not going to give you a definition. In the previous roundtable was sufficient, I feel. Last Monday or Tuesday, I did a Google search and it brought up over 40 million results. And they were very varied. The first was a little company, a training company called Open Health in the Paris suburbs, and there were more institutional ones too. And we dissected all that for you. So what was said at the previous round table was quite sufficient. With Guy and Olivier, we've decided to take 3 little videos. They're very practical. And the second and third are things that actually happen in the health sector, in hospitals or old people's homes in France as a routine. The first was produced and broadcast by an industrialist in the drug sector. And you'll see that it's quite refined. It's a very nice video that gives you some food for thought and makes you want to look at it. After each of these little videos, we'll have a short discussion with the 2 colleagues that use them every day in their establishments. The first one lasts for 2 minutes and 50 seconds. It was not bad, was it? So once you've seen that with Guy and Olivier in July when we saw it, we said, oh, well, that's really something that shows you all the fantasies and hopes. It's exactly the same video. It's just the sound and sentences that gives you a different vision about all the things that you can actually fear and hope from open health. It's rather like Dr. Jekyll and Mr. Hyde for those of you who have more about the cinema than actual books. It would be Mr. Jekyll and Dr. Love by Jerry Lewis. You were probably listening to a Radio Classique like I was one morning, and you heard that there was an agreement that had been signed between Sanofi and Google, which gives you even more relief in terms of the video. And if you look at the sequence, when we looked at the sequence several days ago, we said it's very, very curious to see an industrialist in the health sector. We all know that the production cycles are about 10 years, and see how they can come to an agreement with Google in only a few months. I'm looking at Jean-Louis Baye. It's very curious to see what's going to happen. 600 million diabetics in the world, and that's the market they're aiming at, obviously. We'll take a look at 2 other videos that are far more practical, and then we'll have a discussion with people who use these every day. Just a minute, because we've only got about a quarter of an hour or 20 minutes. Agnes is going to have an operation on her hip in a week, and she's rather afraid. Fortunately, with Sovanti, she can fill in part of her medical record herself at home on the computer, the tablet, or the smartphone with items such as her temperature, her state of health, or any specific need she has. The questionnaire also checks whether she's taken her drugs properly and, if necessary, whether she's fasting or not. And if there is any problem whatsoever, the hospital will be automatically informed and will call her back. Agnes is reassured her operation is very well prepared. Opposite her, Dr. Martin is reassured too. He's got all the information he needs for the operation. It's all been keyed in and checked. And that's as much time saved and even more safety. And he gives her the indicators that she's going to have to use when she goes back home. She can tell him about pain, bleeding, and side effects. The system automatically transfers this information to the health care establishment, and a warning message flicks up if anything looks suspicious. Agnès is then called back by the doctor, and her post-operative follow-up will be adapted. All the information and the decisions concerning Agnès are tracked and registered in her medical file. For the hospital, the follow-up is improved and simpler, and the doctors can allow their patients to go back home in all safety. But it does even more. It also supports the patient once back home with a rehab program on video, which shows her exactly the movements that she ought to do after her operation. Suivi is a pragmatic system. It's also intuitive and simple to use. 94% of the patients to whom it has been offered accepted it, all generations and all disorders together. So Suivi is really a system that is going to be a revolution in the connections between the patients, their doctors, and the hospitals. The choice of this film was to offer something very simple that promoted use rather than technology. Sanofi showed us that technology was here. It's what you use it for, which is going to tell you whether there's an opportunity there or not. So I'll ask Jean to talk about Suivi because I think that that's an illustration which is the fruit of a meeting point between a surgeon and a pilot who wanted to share more than just a checklist. This application shows that very well indeed. Good morning, everybody. Yes, in fact, the company was created by a former test pilot and airline pilot. He drew a parallel between surgeons and airline pilots. And with Philippe Cabarrot, who is somebody you know, I think, they had a discussion and said that at the end of the day, an operating theatre is something that, because it's rather stressful for the patient, and when the patient is curing from a disease, the operating theatre is only something quite short, really. So once the operation is over, then he can forget it. Well, you said that simplicity was the keyword, the most important keyword here. We wanted something that was not so specific that the patient had to buy equipment, something that wasn't too complicated, they didn't need to be trained for. And the principle of the system is that it's got to be simple and easy to use so that people want to use it. So we developed this system for that purpose, and the patients ask for the system, and so do the doctors. Right, well, we'll come back to that later. We'll go on to the third video now. If we could just launch the third video, please. Mr. Deveau told us this morning that he had a painful area in the upper right-hand part of his jaw. And it's very easy to get the nurse to come along with the trolley to do a workup for the dentist. It's an easy way to launch the patient into the healthcare system. There's a safe system, and anything that's sent on the system can be tracked. It's sent to the dentist, who interprets the pictures and then sends back a report, which once again is sent through the SAFE platform, either directly to the hospital or to the doctor's consulting room. The value of this project is that the workup can be done by the dentist who comes to the hospital. It's important to work locally. And in the telemedicine center, there are several connected objects such as dermatoscopes and electrocardiogram machines and other accessories such as audiometers, which can be sent to an ENT specialist. It enables you to be more responsive and avoid having emergencies. Telemedicine is also something that enables you to educate your patients. Right, so to briefly comment that little video from Bordeaux, from the Old People's Home in Bordeaux. Philippe is the former deputy managing director of Corian. So Philippe, what do you have to say? Well, we know how to use these things, but they're not very frequently used. A lot of this equipment is just there in the cupboards and is not used, because we've really got a medical and economic problem here in France. Telemedicine is something that is going to oblige us to rethink out the model. We have a system that's organized in silos, and with telemedicine we could probably do measurable prevention. We've got to be able to change paradigms and, for example, say, well, to make real savings that are measurable, we're going to have to use these gadgets that would enable us to fund the system.